I did ask you, about when would you outsource or why would you not outsource? And I think I speak about outsourcing in a partnership kind of way. Because there's a reason why we outsource. Because, as I said, for some of us, we're the only person in the whole CSI division. So we're looking for resources, we're looking for capacity. For some of us, we're not an expert in the area we want to develop, so we're looking for expertise. So the question is here about where do we see this relationship? And traditionally, and this is the words, and you'll see it now for the first time, this donor and recipient kind of relationship, which speaks to an imbalance in power. So why do grant makers or donors or investors outsource versus what do they outsource and how do they outsource? And we find more and more that this relationship is changing, which is why I challenged you earlier. If your grant-making principles and criteria is still focused around just NGOs, I want to caution you. Because to get really what you need to affect the change may not be encapsulated in that industry. Let me give you a good example. Quali Health. How many of you have heard of that organization? This is a lady who started health services. Her theory of change is to increase access to quality healthcare. So what does the current system look like? The current system is you either have a medical aid and you can afford private practice, or you don't and you are reliant on government service. That's the two options today you have. You're either rich enough or you're too poor. So she saw this opportunity in the middle market. People who work, who have an income, who need health services, but that cannot or don't have access to medical aids, and who don't want to fall into this, let's call it poor health services. Now, if she had to approach you for funding, you would have said no because she is not an NGO. Let me tell you, it is one of the best development models I have come across in my life. She was profitable within 3 months. I just want to make this point. This is a single person, you don't fund individuals. She doesn't have an NPO certificate. And yet, she's on her way to establish 200 clinics in townships in South Africa. She don't need your money anyway. I'm just saying, so if you're so fixated on a specific application to a solution, and this is now where we get into the space of social innovation, you're looking for sustainability. This woman was sustainable within 3 months. Hello? This is where development is happening. This is where change is happening. This is where innovation is happening. So be very clear now going forward what you say no to. Because if you're going to keep on focusing on training healthcare workers, home-based healthcare workers, and you're so fixated on sustainability, where's the sustainability in that model? So this leads me to this whole relationship between partnerships, exit, and sustainability. And I have spoken to NGOs, and because we're about 60% through the 3 days. And we've spoken very much about an investor perspective. But we have asked the development sector about what are their biggest issues with the funding sector. And I can tell you here, they accuse you of lack of focus, which is why it results in 500 applications a month, because they don't know who does what. Now think about our sector. There isn't a database even about who funds what, who funds whom, which is why there's such a lot of wastage and inefficiency in the system. There's delays in disbursements. They accuse us of donor-driven priorities, not real community needs, uncoordinated donor practices, short-term focus, uncertainty about reporting and standards and quality, uncertainty about roles and responsibilities, centralized versus decentralized decision-making, knowledge about development issues, inflexible strategies, and there's no help. You just want to fund the outcomes of your program. There's no other help. So understand as well, we cannot be successful in this practice if we don't understand the other side of the equation. So NGOs are really saying to us, and this is why I've started with that first slide in the trends presentation, how bad is bad? Because what the biggest help is you can provide to the sector is to share information, is to share research. Because if we want to really make and ensure sustainable development, we've got to cut out what doesn't work. And our evaluation practices, that information needs to be shared. We need to standardize and simplify. We need to be transparent. We need to get out of the short-term funding cycles. We need to use common and transparent indicators. We need to have clear rules for grant making. We need to reduce unnecessary admin procedures. And we've got to think further than operating expenses versus program expenses. Now, here's a question, and you raised it earlier today. If you didn't have a car, if you didn't have a cell phone, if you didn't have a computer, how would you be a practitioner? Your corporate's paying for it. So it's the same expectation. How do you expect them to do their job if you don't fund that? So I'm just saying we've got different rules for the two, and this is what contributes to this constrained relationship. And so I do want to, and I have to, it's my responsibility to highlight to you that you've got to start having a consideration for the total cost of your intervention. As much as you've got to be transparent about your total budget, you've got to have guidelines for core support or general operating support, administrative expenses, and fundraising expenses if you really want to bring about sustainability in the sector. You're fueling unsustainable organizations, unsustainable development practices by ignoring these things. There's a reason why we enter into this partnership. If you want to share the outcomes, if you want to share the impact, you've also got to share the risk. You can't just say, this is the impact I've achieved, because quite honestly, you didn't. So let's be fair. The ability to leverage resources come at a cost. The ability to leverage expertise, resources, the ability to scale and replicate come at a cost, because somebody had to pay for that learning. And you've got to recognize it. There's no way, as a consultant, just take by comparison. I would be a consultant if you didn't reward me for my knowledge, my experience, and my skill. That's the exchange of service. How is that different to the service an NGO delivers to you? Why would you regard my services as more valuable as opposed to the partnership you've entered into with an NGO? So I'm just saying, let's just be fair in all of us.